This podcast is brought to you by Conquer Cancer, the ASCO Foundation. Our mission is to accelerate breakthroughs in life-saving research and empower people everywhere to conquer cancer. Welcome to Your Stories, a podcast where we hear candid stories from people conquering cancer. I'm your host, Dizon. And for Dr. Kekoa Taparra, there was a time when cancer seemed to be an almost inevitable part of his life. Growing up in a remote area of Oahu, Hawaii, Dr. Taparra recalls witnessing his younger cousin's struggles with neuroblastoma, watching his mother lift and carry his aunt as she coped with breast cancer, and hearing the sharp cries of another aunt suffering with endometrial cancer. Seeing his loved ones affected by cancer left a lasting mark on Dr. Taparra, which is why he focuses much of his work on addressing the various inequities that face Native Hawaiian and other Pacific Islander communities. With many living in remote areas, NHPI patients often have limited access to the latest medical advancements, including for cancer diagnosis and treatment. Moreover, NHPI patients have some of the lowest rates of inclusion in clinical trials and oncology research. As a result, data about these patients is often scarce, leading to poorer health outcomes and fewer support resources. In 2023, supported by a Young Investigator Award from Conquer Cancer, Dr. Taparra launched an ongoing research project that involves using machine learning to investigate the various drivers of NHPI cancer disparities. He joins us today to share more about this important work and to share how his upbringing fueled his dedication to conquering cancer for every patient. So welcome, Dr. Taparra, as we conclude Asian American Pacific Islander Month here in the United States. Really an honor to finally meet you and have you with us today.
Mahalo for that amazing introduction. Aloha. Aloha, and mahalo for the opportunity of being here today.
Well, we're really excited to have you. But before we get started, let's hear where you are joining us from today.
Yeah, I'm here in sunny Mountain View, California, which is between Stanford and San Jose.
All right, very good. So before we delve into your family's experiences with cancer, can you tell us a bit about your upbringing and how it affected your understanding of the world, particularly as it relates to both sickness and healthcare?
Absolutely. Growing up in Mililani, which is up in the mountains of Oahu, a former pineapple field town, I grew up just a few streets away from my grandparents. And so from a very young age, I was deeply integrated within our communities back home. And I got to see, not only grandparents, but also great grandparents and how they were able to go through a variety of different chronic illnesses. And I really think that watching them go through those things really allowed me to become the physician that I am today and have the ability to talk to a lot of the patients that I get to work with today. And so, for example, witnessing my Native Hawaiian grandfather's routine trips to dialysis, where we would go in every Monday, Wednesday, and Friday. And not only would he, as my loved one, be there, but I would see so many other Native Hawaiians there. And while that obviously isn't cancer, it was showing me this broader spectrum of health issues that really impact our population. And so in this environment, I also realized the stark absence of Native Hawaiian healthcare providers, as there weren't really very many role models within this healthcare field in my community. And so truly, I never envisioned a career in medicine for myself because of that absence. And so my path really ultimately changed throughout my career as I found more and more mentors who played pivotal roles into getting me into a career in medicine and research. And that's ultimately what I think helped shape my current view of how patients can ultimately be treated, especially those with cancer.
So just for our listener group, both Dr. Taparra and myself, can I call you Kekoa and you can call me Dawn? Is that okay?
Absolutely. Yes, absolutely.
So both of us are actually from the Pacific Islands, myself being born on Guam. But so many of my relatives, when they left the island, would go to Hawaii for treatment, at least as a stepping stone before they went on to, say, Stanford or UCSF for more specialized care. But I wonder, Kekoa, when I grew up, we did primary care in Western medicine clinics. But as a child, my mom also took me to alternative medicine docs. If I had a cold and I wouldn't get antibiotics, I would get these herbs or some kind of vapor rub. And so it was always this struggle that I had when I was growing up of belief in science, the belief in Western medicine, and this culture. And I was wondering if that was a similar experience too that you could talk about.
What a fascinating question. When you said I think of Vicks vapor rub or like Tiger Balm,
Which
the things that,
you can swallow, you can breathe.
very, very versatile. But no, those are absolutely things that people in my family would provide with us when we were sick. But I think that gets to this important point of immigration and colonization in the Pacific, right? Those are more Eastern sort of philosophies. And especially in a place like Guam or Hawaii, we have so many different types of people and we bring so many different cultures and values to the table, especially when it comes to things like how do we treat a simple cold, right? And so I definitely agree with you. There were a variety of different things, different teas, elixirs that I think that my family was really accustomed to. But one of the things that your question also reminds me of, and I think we'll get into it a little bit later in the conversation, but I do remember that the auntie that you spoke of, she had metastatic endometrial cancer that got caught very late. She was bleeding heavily for quite some time, but just never really felt comfortable going to her physician. She didn't feel comfortable talking about the bleeding. And that ultimately led to obviously her very late stage cancer diagnosis. But when I think about your question of different types of medicines, I remember one of the things in Native Hawaiian culture that we have of medicine, obviously very plant-based, not necessarily chemical-based, but plant-based medicine. We have this thing called noni, which is a fruit. And I remember my auntie really wanting to take these noni pills, their condensed form of the plant, because that's something that really aligned with her and her values and her types of treatment that she wanted, in addition to obviously the treatment for her metastatic cancer. But she was really met with some resistance. So I really think, upon reflecting even now, of being able to understand where patients come from when they have those different beliefs and thoughts and perspectives that you're bringing up. Like, how do we as physicians better communicate with them and encourage them to go through with Western medicine and go through with their cultural practices? And I think that there is a world where we can do both, and I think that being born in Guam, being born in Hawaii, I think we've had the opportunity to see how that could potentially benefit a lot of patients if we could do that more.
Yeah, I agree. And I think we talk a lot about diversification of the workforce and making sure there's representation from everybody. But I think for those of us in this Native Hawaiian, Pacific Islander, Asian American communities, that integration is so critical for folks in our communities. No one wants to be belittled because they believe in the power of betel nut. But what we can do is provide space for them to discuss it and also not dismiss it. And I think that is as important as telling them the benefits of our treatment based on randomized clinical trials. All right, getting back to your story, can you tell us more about your family's experiences with cancer, which I spoke about a little bit earlier? Maybe you can walk us through what it felt like from your perspective, looking back and being the witness to your loved ones facing that diagnoses of cancer.
Just to be clear, I've had over a dozen family members, all who are Native Hawaiian, who've developed cancer and sadly passed away from it. And oftentimes these were, as I now see it, as diseases that potentially could have been treatable. So it really started from the time that even I was a young kid. I was about 3 years old when I first had, an auntie diagnosed with breast cancer at the age that I am right now. And a story that gets told within my ohana that still sticks with me today is apparently, when I was 3 or 4, my cousins were coming over and apparently I said something along the lines of, your mom is going to die. And that was devastating to hear from my older cousin, obviously, and is thus still, unfortunately, a story that gets told today. But I say that story really because I think it underscores my early awareness of this fatal disease and the impact that it has on my ohana from the time I was only 3 or 4 years old. And speaking of a 3 or 4-year-old, I also think then about my cousin Kaleo, who was also diagnosed with neuroblastoma, as you mentioned. And I really witnessed how, whether it was the treatments that my auntie and uncle had to bring my cousin too, or the long nights in the hospital, or just ultimately seeing my cousin wither away and his hair going away and just living in a hospital and not being able to live as a normal kid. I really saw how this disease really strips away the dignity and the overall life outcomes from a lot of my ohana. There's other stories as well of my auntie who was again diagnosed with endometrial cancer, and just the screams that she had as she was suffering from her metastatic disease as it was going all throughout her body. It was something that none of my family members have forgotten today, even with my dad, as he held her hand at my granny's home because she didn't have enough money to have her own home. And she just passed away at home. Like, that was something that honestly, I can't even talk about what I do within my own family now, because it brings up too many scars that really hurt them today. So I think overall, with 12 family members, whether it's endometrial cancer, breast cancer, lung cancer, prostate cancer, neuroblastoma, these diseases really have impacted our family's perspectives of cancer. And really, it motivates me to want to come back home again so that we can contribute to this workforce that can ultimately maybe make a difference in the lives of future, Native Hawaiians and other Pacific Islanders and other local people on our islands.
It's a very sobering experience watching that as a child. I wish I could tell, just like you, I wish I could say that those were the motivations of why I went into medicine, just seeing illness in my family. My grandmother died of head and neck cancer. But what's curious, Kekoa, is my family really never talked. So, there's some communities where it's not that it's a shameful diagnosis. Maybe it's just too scary to talk about. But it's also, you'll appreciate this being from Hawaii, but the folks who were diagnosed with cancer on Guam had to leave for treatment.
Absolutely.
And so oftentimes they never came back, and so there was also disassociation from your support networks that I don't think a lot of people in the continental United States may even be aware of, that that's a lived experience for people from the islands of the United States.
Yeah, absolutely.
So let me go further from your experiences. And you had mentioned that you didn't set out to become a physician, but it was something that evolved over time based on the people who came into your life and guided you. But what are some of the most common challenges that you see now for our communities, NHPI people? What are some of the challenges that they face with cancer, and what makes those challenges so prevalent, do you think, in our own communities?
Yeah, I think that for me, growing up in Hawaii and having my family members go through different diseases, including cancer, I've really seen how geographic isolation has really impacted our communities, whether it's the flow of information, whether it's the access to resources. I really do think that we've lived in a world where there's been little access to a lot of the resources that we have on the continent. But I am hopeful that some of those things may change in the future, especially in the more digitized technological age that we live in today. But in terms of geographic isolation, one of the things that comes to mind, for example, is when my uncle recently passed, unfortunately, of his metastatic prostate cancer a couple years ago. I remember after he passed, having a conversation with my auntie, his wife, who then told me, being even an island like Maui, where, a lot of people might go and visit and, have a good time as tourists, may think that it's a kind of more developed island compared to, let's say, Molokai or Lanai. Even my family on Maui, when they went through the end of my uncle's life with prostate cancer, she really told me that moving to Maui meant that they were going to die of some disease and not have access to those resources. And that really breaks my heart, because I know that to choose between family, community, and place of identity versus health, like, that's a really hard decision to have to make. And so for my uncle, when he was going through this end stages of his disease, there were points where he literally could not move, not just from the weakness of his treatments and weakness of his disease, but also just like the pain that really immobilized him. And so I remember being on the phone with him. I was on call actually at Stanford doing my call work. And then my auntie would call me And they would just ask, like, what can we do? How can we get certain treatments, including things like radiation? But the doctor was on Oahu. So what that would have meant is to schedule a plane ticket, buy a plane ticket, and have that money for the plane ticket, then make that whole trip over to Oahu from Maui, which my uncle really couldn't do because of the immense pain due to the prostate cancer. But then ultimately, he would then have to get transportation, find a place to stay. It's really not something like you could drive 2, 3, or 4 towns over to get this treatment. Like this is, you have to fly hours to just get on a plane to then go to the health facility. So I think that these are real barriers that people in island communities like Guam and Hawaii have to deal with. And that's really compounded by the social demographic and socioeconomic factors that really are impacting our communities as well. But ultimately, I think that a lot of these challenges, including resources, access to care, I think that with technology, I think a lot of these things hopefully can be improved for future generations.
Yeah, I really want to explore that, and I think we will have a chance later on here as well, because I think it's a fascinating promise that technology holds for our communities, especially. And this is leading into the next question. You've talked a little bit about remoteness as a disparity in terms of accessing care, but if you think about, again, your experience of you and your family in various parts of Hawaii, and you think of that aspect of staying not on Oahu, where a lot of healthcare is concentrated in Hawaii, how would you characterize remoteness as a barrier to effective healthcare?
In terms of remoteness, you could think about it, I think, either as the geographic type that we've been talking about, where there's resources that are designated in certain areas that you may not have access to because of barriers geographically. But then there's also, I think, this social isolation of social barriers that also exists that we should also talk about as well. We've already kind of touched upon things like betel nut and noni and other types of culturally relevant medicinal plants, or I guess carcinogens. But I think it's the social isolation in the standpoint from not being able to really feel like you're being understood when you go to the doctor and explaining the issues. I think that's really apparent even in some of the research that I've been able to review over the past few years. Really, it comes down to the interpretation from the Western world, including physicians and researchers, that a lot of our members of our community just don't have education or don't have health literacy. But in fact, I think it's just that we're oftentimes more afraid of not being understood or afraid of being isolated, and oftentimes even afraid of letting a doctor down, right? And I think that sometimes the patients that I know within my community really don't want to let physicians down. And so I think that they're oftentimes willing to do a lot in order to get their treatments. But that sort of patriarchal version of medicine, I think, ultimately is problematic, because in a shared decision-making world that we're kind of transitioning to today, I think that there's opportunity to really break that kind of social isolation of people who, like within my community, who aren't really exposed to medicine that often, bridging that gap by kind of really hearing their values and understanding their values to incorporate that into treatment plans. I think that that is really what we should be striving for.
I think I agree with everything that you just said, and I couldn't have said it better. All right, now we get to the good part. Tell us about your research, particularly the machine learning aspects. People probably have heard of this phrase, machine learning, but how it applies to healthcare, and especially how it applies to oncology, is pretty complex. So, what is machine learning, and then enabling you to do that perhaps you can't do today, or you haven't been able to do it?
So I just want to make it clear up front that I by no means am a machine learning or computational expert. I am very fortunate to be at Stanford. That is a place, obviously, with a lot of people who have this level of expertise, including Dr. Ioannidis, who is one of the PIs here at Stanford, who is a mathematician, who works on small populations, both from the genetics level, but then also on our projects, looking at issues including multiraciality in the setting of patients with cancer. And so by means of talking about our project, I'll just kind of lay out the problem, which is that many indigenous populations, whether it's Pacific Islanders or American Indian or Alaska Native populations, due to our centuries of colonization, that is, people from not our communities coming into our communities, because of that process, that's led to generations of multiracial indigenous people. And so when you think about it, when you even look at the 2020 census data, the most multiracial people are not Black, white, or Asian. They're actually the indigenous folks. And so this issue is really important when it comes to how we code data. And so what I mean by that is oftentimes when we do racial disparities work, it's a simple column with one race that is then assigned to the patient. Then that's what we use to analyze the data. However, again, in this context of indigenous people, that's not quite how this works. And the problem with that is this issue of structural racism, where there are then data practices that, because of the structure of the data, meaning you can only include one race, we then get excluded altogether. So, for example, a Native Hawaiian who is also Black would then not get counted as Black or Native Hawaiian, and then they would get put in other or multiracial. Likewise, there are other studies that then aggregate data, where they aggregate Asians with Pacific Islanders, therefore masking Pacific Islander data. And that's problematic because ultimately we, as smaller indigenous population, don't ultimately get to see our data. And I want to be very clear that when I say small population size, I don't think that that is an excuse for not including data. I think that we always have to remember the reason why populations, especially those who are indigenous, are smaller relatively has a lot to do with colonization. And I mean that by saying that within the first 100, 120 years of colonization for Native Hawaiians, at least 95% of our population went extinct. And so we are still recovering in this U-shaped curve of our population that was pre-Captain Cook, pre-Western colonization. So we always have to keep that in mind when we think about small population sizes. So how does that relate to machine learning? So because our normal conventional regression sorts of analyses are very constrained in terms of these caveats of linearity and you kind of like simple associations with variables, it makes it very hard to evaluate things that are very complex, like multiraciality. For example, comparing a Native Hawaiian Black person compared to a Native Hawaiian white person compared to a Native Hawaiian Black Asian person, it gets very complicated as we get more and more of these different combinations. And so what machine learning is able to allow us to do is kind of go beyond the caveats of linearity, meaning like a one-to-one kind of association, and look at it more like a tree with lots of different branches, where the machine learning algorithms can then go down each individual branch, which represents, for example, different races and race combinations, to then give us a better idea of how cancer outcomes may relate to these combinations of different races. And so ultimately, what we have been trying to do with these techniques is to then understand, are multiracial Native Hawaiians and Pacific Islanders, do we fit better together as one group rather than separating based off of the other multi-race categories? And my hypothesis all along has been, through my experiences and the experiences of my community, that I don't think it matters whether or not you're Asian and white and Pacific Islander or Black and Asian and Pacific Islander. I think being Pacific Islander, because of the things that we've talked about, of these social contexts and the isolation geographically, a lot of these other things are playing into the race, and race is actually serving as like a surrogate for some of these other underlying issues. And I really think that from our work with Dr. Inequities and his team, we're really starting to put the puzzle pieces together in terms of what this multiraciality can actually mean for big complex data. And I think beyond Pacific Islanders, this work also has implications for how we deal with multiraciality in general, because within the 2020 census, we are seeing an escalation in the number of multiracial people in this country. And so understanding these complex issues through a model like Pacific Islanders, I think can tell us a lot about how to handle data in the future.
So, Kekoa, you covered a lot there. That's pretty amazing stuff. And actually, I think the whole idea of how to treat multi-ethnic backgrounds is so critical. And we're seeing this just as we're trying to use constructs outside of the United States. And this is so plays out in places where multiculturalism is the norm rather than the exception. This idea that if you're Native Hawaiian, you have no other background in your heritage is a falsehood. Yet, and I don't know if you had this same experience, it's like people who are Filipino will claim Asian, while others will claim Pacific Islander. If you think about it, that's kind of where race falls down, because race is a social construct at the end of the day. But it gets so much more complicated when people have different racial backgrounds and how A, to classify them with machine learning, but then B, how they classify themselves. So I think asking the questions that you're asking are going to be hugely relevant, particularly to this growing population of multi-ethnic individuals in this country. And I think the government in the United States is picking up on this important concept that we are all not homogenous people. So I think that's really, really very cool. When you think about the machine learning that you're doing, can you point to, say, let's say 10 years from now, some practical ways that might inform the approach to cancer, whether it's from screening and prevention all the way up to, say, palliative care?
Thinking ahead in the future, whether it's in the clinic or whether it's policy-based, I think that some of this machine learning work that we're doing now is really elucidating how best to manage data, because I don't think that we have a good understanding of that right now. I think a lot of people have tried to make estimates of models that may not based off of any data, but have been trying to see the best combinations of how to deal with multiracial data. But I think in the future, we should have evidence-based methods and approaches to how to deal with what happens when someone's more than one race. If I'm thinking 10 years from now, the very first thing that I really hope to get accomplished is just the acknowledgement that Pacific Islanders, we exist. We're people from across the Pacific. We're Melanesian, Micronesian, Polynesian. And from these three ethno-geographic regions consist of a heterogeneous group of 20 to 30 Pacific Island states, territories, countries, nations. And I really think that if there's anything that needs to be done in this next 10 years is the acknowledgement that we exist so that we can be better evaluated, so that services and resources and funding can be sent this way to better evaluate and better support these populations. So I think that that's one thing I think that the work in general, including the machine learning work, I think can do. But I also think on a level of beyond the machine learning, one of the things that I really am hopeful for is the future of the physician and scientific Pacific Islander workforce. I think that growing up, you see people like Keanu Reeves or Jason Momoa, or The Rock. These are all Pacific Islanders who are multiracial, who are in movie and film. My classmates at Kamehameha, where I graduated high school, literally my class of 2008 was the children's choir of Lilo and Stitch. So growing up, our population is really into entertainment and those sorts of things, but I never really saw ourselves in healthcare or medicine. So when I think about what I would like to change in the next 10 years too, it's also about the physician workforce. And I've had the extreme privilege to be able to work with this lab of over 20 students at this point. It all started from a paper that I actually published in one of the ASCO journals about Pacific Islander health. And one person read it, and then we started collaborating, and that kind of snowballed into this whole group. And I really see the potential of the students that I get to work with every day and their futures of becoming scientists and physicians. And it really inspires me for that next 10 years. We will be seen more in these spaces. Nothing wrong with entertainment, but I also want to see us more in these sort of spaces of healthcare and science so that we can better contextualize data, so that we can better care for patients with the types of culturally competent care that we would want our families to have.
I think I could not have said it better myself. So I'm actually going to digress and I want your thoughts on a sort of a personal issue. I knew I wanted to be a doctor from a very long time. And my dad was very out of this. So when I was in high school in the late 1900s, mind you, so I'm a little bit older than him, he bought land and said, this is where your clinic is going to sit. I think he was a little disappointed when I said I wanted to be an academic physician, which meant I wasn't going to come back to the island. It's this point of being pulled back to your roots and establishing your presence professionally, which for me was very important. I could make a go of this, and I'm glad I did. But there's always been this part of me that sort of says, I should have. I should have gone back and I should have been there and provided that care. And every time I've gone back home, I get that same comment. It's like, oh, you should come back, doc. We need you here. I wonder, A, if this is an experience that you've also have struggled with, and B, how have you sort of found peace in your decision?
This is a fantastic question, and obviously something that I'm currently going through as a rising chief in radiation oncology at Stanford looking for a job. Let's start with that. No, but this is a really critical question for so many of us who grow up on islands, right? I think that for me, coming back home was actually the reason why Dr. Futran and Hopkins actually encouraged me to, in addition to my PhD, pursue a MD, because he thought that would be a more viable path for me to go home. And so that was actually the point at which I decided to go into medicine, was the real answer to my question of how do I get back home. I think I have to be honest and say that it is very hard for many of us who grow up on islands to come to the continent and see the luxuries and see the access to not just healthcare, but also things that are, nice in life. And I think that that can sometimes be a distraction for me specifically, but going back home every single time, I then get grounded with my roots, with my ohana, with my community more and more. And I think that that is what helps me maintain my goal. I will say that I think it's been harder to go back to our island homes for generations before mine. And I think that many people who have done the work to go off to the continent, get the education, make a path for so many of us that then followed. That was the trailblazing work that needed to be done to make those paths, right? For then us, next generation, to then come even to have the option of returning home. So I do think that with time, it's becoming easier and easier to make our paths home. But the reality is it's really hard to work in a place that has less funding, less resources, less access to people, personnel. When I think about even my island and my parents and grandparents, every single time I come back, they're always telling me that they have a different physician taking care of them, right? And so we don't have physicians within our communities that are trained within our communities, that stay in our communities. And then we have people who are coming in from the continent as well, who then don't really know our island life, don't know our culture, and then want to leave. And that impacts both ways, both people who don't know our islands and then are able to come now and then leave, or those of us who are from the islands then come to the continent for training and then try our best to come back home. I will say neither Hawaii nor Guam has a radiation oncology residency training program, for example. So the fact is we have to leave, right? We have to leave to get this training in order to bring it back. And so I don't think it's any person's fault for leaving in the first place, because I think that there are just certain things that we need to get done and leave the islands to get the training. But I really feel like we're at a point in time where there's a change in mindset of this brain drain thing. Because at least for myself, when I was growing up in Hawaii, there was kind of a status of, oh, if you made it to the continent for school, like you made it, a little bit of that. But I think that that's starting to change now. There's a lot more pride of being able to come back home now. I think for the prior generation, that's really hard to do, especially when you're very well established and you have your whole life somewhere. But I think for those of us who are kind of in my position now and in the middle and figuring out what that next step in life is, I think it's actually more attainable now to go back home because there's less of the stigma of returning back home too. So I think what I'm trying to say is ultimately it is a very challenging dilemma to have of leaving home, which is an island, to a continent with a lot more to offer in some ways. But we have to remember that our communities are back home, our roots are back home. And that's ultimately, at least for me, the reason why I do want to make my next step to go back home.
Well, I will say my only advice as a much older person is listen to your heart. It won't steer you wrong. And I will also say that no matter how far you travel, home will never leave you. I am as much a son of Guam today as the day I left. And there's such pride in that for me. Just follow your heart and the opportunity, but you also can make your own opportunities as you've done already. And speaking of that, tell me as we conclude, how has this Conquer Cancer grant enabled you to pursue this work, and what impact has it had on your research?
I'm so grateful for Conquer Cancer and the Young Investigator Award program, because I think it's done so many different things to help advance my career. Obviously, on one level, providing grant funding is really important for getting data, which is incredibly important for the type of work that I do. But it's also really important to find collaborators and pay for collaborators and personnel who actually have the expertise, including things like machine learning, that's so vital to investigating some of the complex questions that we have in this grant. I think that Conquer Cancer, on another level, besides grant funding, has also given me a voice. I think it's given me a space to promote our work and the work that my group is doing. I think that oftentimes our type of work isn't really prioritized at certain institutions. So I am very, very grateful for the amplification and truly just the investment in me as a upcoming trainee and soon to be physician scientist and the work that I want to do. And I just feel like by receiving this type of award, it really expresses to me the interest and the passion that an organization like Conquer Cancer has in supporting issues that are very important to me and important to my community, such as healthcare and cancer disparities among the Pacific Islander population.
Well, that's fantastic. And congratulations. Thank you for listening to this podcast, brought to you by Conquer Cancer, the ASCO Foundation. Conquer Cancer is creating a world where cancer is prevented or cured, and every survivor is healthy. You can make a gift at conquer.org/podcast. The participants of this podcast report no conflicts of interest relevant to this podcast. Full disclosures can be found on the episode page on conquer.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.